Today, we'll discuss one small kitchen change that can modestly lower blood pressure for many adults, switching from regular table salt to a lower sodium, potassium-enriched salt substitute. Important up front, this does not replace prescribed blood pressure medication. It can be an additional dietary tool if it is safe for you. General education, not personal medical advice. Do not stop prescribed medications without your clinician. Let's make the problem practical. Many people are told, just eat less salt. But food without salt often becomes less enjoyable, and that's not a sustainable plan for most older adults. So the better question is, can we reduce sodium without removing the salty taste? Regular salt is sodium chloride. Sodium intake is associated with higher blood pressure in many people. A common salt substitute replaces part of the sodium chloride with potassium chloride. That means less sodium, more potassium. What does the evidence say? A recent systematic review and network meta-analysis of randomized trials found that moderate potassium, lower sodium salt substitutes reduced systolic blood pressure by about 4 to 5 millimeters per mercury on average. For long-term outcomes like stroke and death, the most convincing data come mainly from one very large trial in rural China, where people use more discretionary salt in home cooking. In that setting, stroke and cardiovascular events were reduced. Now, here's the key limitation for many Western countries. A lot of sodium comes from processed and restaurant foods, not from your salt shaker. So this swap helps most if you frequently cook at home or add salt during cooking. Practical steps, simple and realistic.
Step 1. Check safety first. Do not start potassium-enriched salt without clinician advice if you have kidney disease, a history of high potassium, or you take medicines that can raise potassium, such as ACE inhibitors, ARBs, spironolactone or eplerenone, amiloride or triamterene, or if you take potassium supplements. Step 2. Choose the right product. Look for a label showing sodium chloride and potassium chloride. If an iodized version is available in your region, prefer it, because iodized salt can be a major iodine source. Step 3. Do a 1-to-1 swap. Do not increase total salt use. Use it the same way you used regular salt. The goal is less sodium overall, not more salt because it's healthier. Taste. Some people notice a mild difference at first. In cooked foods, many people adapt quickly. Now, a safety note for older adults. If you feel new severe weakness, fainting, or palpitations after changing your salt or supplements, stop the product and seek urgent medical assessment. And if you are prone to dizziness, stand up slowly. Any BP-lowering change can increase fall risk in frail adults. Zooming out, this is not magic. It's a small lever. If you want the biggest blood pressure impact, combine the swap with fewer high-sodium processed foods and follow your clinician's plan for monitoring and medication when needed. Discuss with your clinician, is a potassium-enriched salt substitute safe for my kidneys and medications? I'm Professor Oleksii Kalmykov. If you want evidence-based, senior-safe explanations without hype, subscribe, and I'll see you in the next video.